With that being said, welcome. We are truly appreciative of who's here with us today. A quick disclaimer: if you are joining us, please make sure that you are on mute as well as have your video off unless you are addressing any questions to our presenter. We want to make sure that we are maximizing our bandwidth and to our presenter for today. So if your audio is unmuted, please go ahead and mute yourselves, and or if your camera is on, please go ahead and turn that off. We will allow time for everybody to present any type of questions and or do offer for you to drop questions in the chat. So again, welcome. I will go ahead and get our technical assistance training introduced, which includes today's EndHIV 901 technical assistance training is focused on understanding anal pleasure and health for clinicians, behavioral health specialists, peers, and HIV workers. So today, a little bit about the webinar. HIV narrowly focuses our attention on the harms of anal sex despite the pleasure people find in practicing it. 40 years into the epidemic, patients often seek accurate, reliable information about anal play that isn't just about HIV prevention. Rather, and they want to engage in ways that maximize pleasure and reduce harms beyond infectious diseases. Often they end up learning harmful myths rather than facts and learning by trial and error. This 90-minute webinar is appropriate for clinical providers, behavioral health workers, social workers, case managers, peers, and support services. You will learn the rationale for why addressing anal pleasure and health is essential in HIV service settings, as well as ways to respond to frequently asked questions, including via a new patient and provider-facing website. Before I go into introducing our consultant for today, I'm going to also share my face with Claire Bolts because she has been so kind to support us in today's technical assistance training for a couple of disclosures.
Thanks so much, Elizabeth. Hi, everyone. I'm Claire Bolds. I'm a senior program manager at the Southeast AIDS Education and Training Center. We're based out of Vanderbilt University Medical Center in Nashville, and we're really excited to be partnering today with EndHIV 901 to provide continuing education credits for today's webinar. So we do have CE available for physicians, physician assistants, nurses, advanced practice nurses, dietitians, dentists, and social workers. I think I got them all, and pharmacists as well. So if you would like to collect continuing education credit for this event, you're going to have to do two things. First, you are going to need to register in our system, and many of you have done that already, so thank you very much if you are already registered. And then at the end of today's program, I'm going to send an email out to everybody who is registered for you to complete a continuing education evaluation. And after you complete that evaluation, you will be able to access your certificate in your dashboard. We do have to manually approve everyone's attendance before an accreditation statement will appear on your certificate. So give us a few days and check back in a couple of days. Should have it done by the end of this week, and you will be able to download your certificate with an accreditation statement on it. So I'm going to send the registration link quickly to the chat. If you are not registered there already, please do so. And I will go ahead and hand it either back to Elizabeth or over to Brian. I'm not sure which.
Me? Yes? Do I take it, Elizabeth? Yep.
I would say you can just send it to both of us just to cross our T's and dot our I's.
Great, thank you.
Can I go ahead and get started, Elizabeth?
I'm going to do your brief introduction, and then you have the floor in its entirety. So it is my pleasure and my excitement to introduce today's EndHIV 901 and technical assistance consultant. Brian Kutner, PhD, MPH, is a licensed and clinical psychologist and assistant professor at Albert Einstein College of Medicine in Montefiore, Medical Center, where he studies how to address HIV-related stigmas. He has conducted NIH-funded, also known as National Institute of Health, mixed method studies to develop measures to understand prevalence and to evaluate interventions for health workers related to anal sex stigma and anal pleasure and health. So again, thank you so much, and I turn it over to Dr. Kutner.
All right, here we go.
You gotta work this stuff. Look at you.
Pain is left.
Oh shit, this.
I think we're in the land of webinar unmutes, so I think we got it. Okay, great. All right. Good morning, afternoon, evening, wherever you are on the planet. Nice to see that you're here. And I'm just going to hop into it. So there's a whole team behind this project, and it's more than just this webinar that we're doing today. I just wanted to thank all the participants and research staff, advisors, and mentorship team, all these folks who've been involved in this. And here's what we're going to do. We're going to cover three things. The first one is a little bit of the science of why this is important. Then we're going to get into the what. And the bulk of today is going to be about the bulk of today. It's a little bit of a joke. The bulk of today is going to be about frequently asked questions and finding answers to those questions. And then I'm going to leave you with some resources, in particular, a website of resources that you can use. I'm going to remind you all to mute yourselves and also turn your camera off, because apparently it's a little bit of a heavy load. If again, another pun, if the cameras are on, it's a little bit hard for the bandwidth. All right, so some guiding mantras before we get started. The first one is slow and steady, and these are mantras that hold true not just for the presentation we're going to do today, but also for anal sex and anal play itself. So I'm not going to be like blasting you with some pornographic images if you're a little bit cautious about that, though some of you might enjoy it. There are some things available on our website if you prefer. But we're going to go slow and steady, and this holds true for anal sex as well. Slow and steady to get into it. That is related to ouch, which means that if there's any sign of pain or discomfort during anal sex, that's an indication that there's potential for damage to be occurring. It is possible to have anal sex without any pain or discomfort whatsoever. This holds true also for us today. If there's a moment when I say something or someone else says something and it feels like, ooh, that's not landing so well, please say something in the chat to let us know so that we can speak up and correct it. And the last one is have fun. Today we're going to have fun, and also when you're having anal play, it should be something that you have fun with. All right, I'm going to give you a little bit of background about why. This is kind of my origin story. This is not me in a towel, but this is close to a place where I used to work. I used to work in bathhouses in New York City, testing people for HIV and sexually transmitted infections. And this is late at night, up until about 2 in the morning. Folks would be wearing towels. I would be fully clothed, my little badge in a well-lit room. People would walk by and kind of look in and ask what was going on. And if they sat down to have a conversation with me, then we would chat about what was important to them, as well as getting them the test and the results. Repeatedly, I would hear from cisgender men in particular who would say, I bleed when I'm going to use explicit language here just to be speaking in the language of my clients. I bleed when I get fucked, but that's normal, right? And it was almost like they were saying, like, I don't know if it's normal, but is it? And it occurred to me that these were folks who got the message to test for HIV and sexually transmitted infections because they were doing that with me, but they were not getting answers to their questions about how to have anal sex in a way that was reducing harm and maximizing their pleasure. This co-occurred with a phone call from a friend of mine who was coming back from the gynecologist, a cisgender woman. My friend, a cisgender woman, coming back from the gynecologist. My friend was in the stirrups, very vulnerable position, being examined. Gynecologist was just about to finish up. And my friend said, oh, could you look a little bit lower? There's a little, I felt a little bump. And the gynecologist looked and said, that's a wart. You have an anal wart. Have you been having anal sex? You shouldn't be having anal sex. Are you married? And asked all sorts of intrusive questions, and then proceeded to remove the wart in a very painful way, leading to my friend crying on the phone with me as she's walking down the street, trying to recover from this really traumatic experience with a healthcare provider. So it occurred to me, we need some sort of education, not just for clients, who are, or human beings who are having anal sex, but also for providers to be educated about this topic. So that's an image of the stirrups, not the real stirrups, but just a metaphor of it. So today, what we're going to do is hopefully you'll leave here with an understanding of the scientific rationale for why it's important to address anal pleasure and health in HIV service settings. Learn how to communicate with your patients or clients, as well as friends, colleagues, partners. Understand how to quickly exchange information in a way that's based in motivational interviewing, which is an evidence-based way of helping people with their behavior. And then gain access to resources, in particular our website. Okay, enough of me talking. I would love to hear more from you. So Elizabeth, if you would drop the link into the chat, this is an opportunity for you to share what you want to know today. And I've found that mostly people want answers to frequently asked questions. So let's see what you all think. This should start to populate here with what you write. And I'd be very curious about that. This one that says test is literally just a test, and I could not figure out how to delete it. So that's why that's there. Here's where you can type in anything that you have a question about. I'm going to let you all do that while I proceed a little bit further, and we'll visit it again. I want to cover a little bit of the research here. Oh, wait, I did see something in the chat just then where there's someone asking a question. Yep. Okay. Someone asking about creaming and is that mucus? Okay, we will get to that one. And so we'll see if other people put things here. Harm reduction practices, how to guide clients on pleasurable anal sex, how to advise patients on douching. There isn't much for lesbian couples, but lesbian couples are definitely having anal sex. Measures to prepare, how long can you keep in a butt plug, discussing ways in a positive way, how to stretch without pain. Okay, you all have some of the very same questions that clients have and that I've learned from participants in research studies also have questions. We may not get to every single question that you have, but we do have a resource website of resources, and you can always contact us to follow up if you'd like some more information. But we'll do our best to answer everything that we can answer in the 90 minutes we've got. So I'm going to cover a little bit of the science behind this.
Brian?
And it starts with
Hey, Brian, I'll make sure
yes.
that if anybody puts any questions related to the Menti, I'll go ahead and type them manually into the Menti myself.
Oh, thank you so much. That's really helpful. So I can glance back there rather than the chat. Awesome. So Elizabeth mentioned that I have a PhD. I went back to school later in life and became a clinical psychologist, and I started to study this this issue of stigma related to anal sex. You may not be surprised by that. It's not rocket science that there's some sort of taboo around anal sex. But as far as I could tell, there wasn't any sort of public health evidence of that, at least quantitatively. So what I did was I interviewed people, I developed a measure of anal sex stigma, and then I did some testing among about 1,500 people. And here's what I found. The folks who said that they were higher on stigma, either feeling internalized stigma, feeling like there was stigma from their environment, other people around them, or that they anticipated stigma, were less likely to engage in HIV prevention, both during sex and also services like talking about HIV, talking about how to prevent HIV, getting PrEP, taking their medication if they're taking antiretroviral therapy. And really importantly, if they were high on stigma, they were less comfortable talking to a healthcare provider. And that really was the link to why they were not engaging in anal, and they were engaging in anal sex, but why they were not engaging in HIV prevention. Here's something that a provider said to us. I think patients know that the majority of healthcare providers don't want to deal with their bottoms. I have so many providers that will send their patients to me just for a rectal exam or to do a swab. An anal swab takes 30 seconds to do. They don't want to do it. And this in red is the stigma. They don't want to go near it. And so it creates a kind of baseline stigma there. Oh God, nobody wants to deal with my, you associate it with poop and smelling and farts and all of the above. And then if you get a sense that your primary care provider or somebody else doesn't want to deal with it, it makes you feel like there's something wrong with that. So again, not rocket science. You all probably could have said, that this is something that you've heard before. Another thing I heard from another participant was someone who had had an anal fissure the first time he had anal sex because he didn't know that he needed to use lubrication. So he and his boyfriend had anal sex. My participant bought him, and then he had to get a procedure, a corrective procedure, a surgery, because it was so dire. And he said to me, I couldn't talk to anybody about that, about bottoming, because I'm like, I enjoy it, but my dad, when he came out to his dad said, you know, you're still my son, but as long as you're not the one who's getting fucked. Again, you can hear stigma there. And then when it comes to the procedure, this person said, I was kind of embarrassed to tell my doctor what had happened with the fissure because automatically, if you disclose as a gay man, the perception is that you're being penetrated. When I had that surgery, I hid it from everyone I knew, except my friend that came with me. It made me uncomfortable talking about it. Literally, I didn't tell my mom, even when I had after surgery procedures like follow-up appointments. There's only one person in my life besides yourself right now that actually knows that I had that procedure done. It's painful actually to reread some of these things. This is an indication there's a lot of silence around anal pleasure, anal sex, and anal health. That's another reason why we're having this workshop, or rather, we're having this webinar. Now, this is the statistical model, which sort of illustrates what I mentioned before. You don't need to know much about this unless you're a scientist, you're really interested. But I want to point out that I also had a measure of social support, of informational support, so knowledge about anal sex and being able to convey that to other people who feel like they need it, and also emotional support for folks who need that information. And that was strongly associated with stigma, strongly associated with comfort, and strongly associated with engagement. And that means that there's a role for us as healthcare providers to provide social support specifically about anal pleasure and health. Now, there are other reasons too. Clients are not comfortable talking about anal health. That's borne out in a lot of different studies. Also, rarely do health workers, even HIV workers, talk about sex with their clients, even with people who are living with HIV. You can see that here, borne out in a study that was conducted over the course of a year. And then also, a lot of times, symptoms that people have that are related to anal health problems go unnoticed and undetected by healthcare. So here are two examples, only two. I'm not getting into the whole kit and caboodle here. You can see that fissures, fistula, hemorrhoids, perianal dermatosis were asymptomatic in most folks. And then also, this is an important one to hang your hat on. Of people diagnosed with a sexually transmitted infection who had multi-site testing, that means they were tested not just in their urethra through urine or a swab, but also orally and anally, anal rectally, 96% were positive only at the extragenital site. There is evidence now that we know that if people don't get swabbed anorectally, there can be an infection there that goes untreated and then causes problems down the road. This is also an issue with anal cancer, lots of other things. Now today, I'm going to focus mostly on anal pleasure. I just want to say this for those of you who are clinicians, providers, who really need to feel like you've got a public health motivation for engaging on this. Others of you who are community health workers, counselors, you may already have a sense that this is important enough. You don't need any of this background stuff. Okay, and also I should say, I forgot to add this a little bit, that anal cancer is elevated among people with HIV, but anal rectal screening, rarely does that happen fully in health services. Okay, so this is actually a kind of a consolidation. What we're doing today is like a distilling down of a 2-day in-person workshop that we have delivered in New York City, in Ohio, but for research purposes, we've delivered it in China, we've delivered it in Tennessee, Mississippi, and Alabama. And we are studying this. And the basics of this workshop are about anal physiology during anal sex, and then also ways to communicate. So I'm just highlighting for you what we cover in that workshop. It's all written here, but we're going to cover stuff that's more specific to, I think, what your needs might be today, which is answers to frequently asked questions. I will just share that from the research in China, here's something that a participant said. You know, we always tell people how to protect themselves, but we don't know how to talk about pleasure or improving one's sex life. As far as I know, no one has done that. I understand that we're always able to tell people what they shouldn't do, and we're not able to tell them what to do. This is something that's been echoed in interviews that we've conducted with our participants in Tennessee, Mississippi, and Alabama. They're saying something similar. And if you're wondering if focusing on pleasure, since this title today is about anal pleasure and health, if you're wondering, is there any like evidence that that's useful? Well, this is a systematic review looking at the incorporation of pleasure into HIV prevention interventions, and there is a positive association. So if you are able to incorporate pleasure, this is saying there's value in that. Again, it's not rocket science, and some of you may have already realized that yourselves, but it's important for us to provide a little bit of evidence too. All right, I'm going to get into anal physiology, but I'm going to do it in a little bit of a sideways way first. Oh, I also should say, this is our website. I will cover our website by the end of today. Lots of resources on this website. So if you have a frequently asked question or need a resource to hand over to someone else, it should be on this website, I hope. And if it's not, you can let us know, and then we will add it to the website. So we're going to talk about the prevalence of anal sex, and prevalence just refers to how many people on the planet are having anal sex. You certainly can see from all these different images over time, ancient times, modern times, even the future of science fiction over here with the, I think it's C3P2, I can't remember his name, and Stormtrooper. So it's been happening. It's not new, not a new phenomenon. Now, when it comes to the data about prevalence and also really just about the science around anal play, we have some data where we're like, okay, we know some stuff, but there's still more stuff to be known. And then we have a lot of data about some things. Like if you think about HIV and anal sex, we know there's a link there under certain conditions without protection. But there are a lot of areas where there's a lot of data-free stuff. There's stuff that people know, that they learn from practice by trial and error, as Elizabeth referenced in the introduction. But there's just some stuff we don't know. So I want you to keep that in mind, that I'm not covering this as though we know everything there is to know. Okay. Now, I'm going to get into anatomy in a moment and physiology, but I want to make sure you're very clear about why I'm covering this in a way for anyone with an ass, not just for gay and bisexual men, because there's a little bit of a misunderstanding that people think this is really just a topic for gay and bisexual men. It's not. If you compare a color on the left to a color on the right, let's see what the take-home message is. So let's do that. So here we've got, let's see, it's men. Now it's very binary in this study. So I assume they're saying cisgender men and cisgender women, but they don't break it down. 5% of men have received anal sex in the past year, among those who are the age of 20 to 24 over here. And then you'll see 23% of women have received anal sex in the past year. So if you let that sink in for a moment, what does that mean? Far more women than men received anal sex in the past year. And this is a very large study. This is borne out in other studies as well. If you think about it, there aren't that many men who have sex with other men on the planet. It's a smaller percentage than the half of the planet that are women, and half of those, and some portion of those women are having sex with men, some portion of them are having anal sex. So just by sheer numbers, the number of women who've received anal sex is actually higher than the number of men who have received anal sex in terms of anal penetration. So here you've got another study that says, by absolute numbers, more heterosexuals have had anal intercourse than homosexuals. And these are in quotation marks because they're scientific terms that are a little bit out of date now. Now, prevalence also depends on how you ask people. If you look at this study of prevalence across different studies, different areas, if you look here, this FTFI stands for face-to-face interviews. So when married men in Benin, country in Africa, were asked if they had anal sex in the past year, 3.5% of them said face-to-face, across from another human being, that they had it. When they were in a private polling booth and did a survey that was more anonymous, it was 5 times that number. So again, you're seeing some indication that stigma is creating silence around this topic. Okay, here's just a summary of the research that I can share with you. Most surveys about anal intercourse, anal sex, and anal play tend to ask just about intercourse.
I just gotta ask, why the picture?
So just for fun, Aaliyah, just for fun, because why not? Also because one of the things that we've learned in research is that some people were like they want to learn more, but they're a little bit cautious about what they're going to see. So I'm trying to ease you into this slow and steady. So you're seeing some, fictional characters having sex rather than real people having sex. Again, if you want to see real people having sex, the internet is available to you. And also I'll show you something on our website that might be appealing to those who want to see that kind of stuff. Okay, there's very little reliable data about lesbians or trans and non-binary people. Bisexual women are kind of incorporated in the literature a little bit. So we have a lot of great studies about HIV risk, and almost I would say this in a way that has kind of distorted the way that we think about anal sex because we associate it so much with HIV, but that's not why people have anal sex. They have it for pleasure. We are missing reliable samples in most regions around the world for how many people and who's having anal sex. We really don't know how often. Most studies just ask, are you doing it or not? And is it this? Is it intercourse? There's no meta-analysis of global prevalence or other forms of anal sex. And I'll say this because I think this is informed by what we call the anal taboo. A taboo is a prohibition. It's often lacking sort of justification or understanding. We may not remember exactly where it came from, but we just feel like, there's something that's not right. So for example, eating the meat of cats and dogs. Incest is another one. That's a no-go zone. And there's an anal taboo. There's something about anal sex that we think, not we here necessarily, but in general in public health, that, we shouldn't be touching on that one. And here's some evidence of that. Only recently has the focus turned to anal sex and heterosexual HIV transmission. Until a few years ago, it was really just about like gay and bisexual men, and that was the focus. But you can see now there are increasingly numbers of studies that are saying, you know what? Women are having anal sex too. It's important for us to talk about this. And only recently, this was an article from 2 years ago, the first condom was approved for anal sex. Okay, get that. That is 41 years, almost half of a century since the beginning of the HIV epidemic when we knew that HIV was transmitted through anal sex. And yet there was not a condom approved for that. Now, luckily, we have lots of other options that are available today to help us prevent HIV. Okay. Let's get into the but what, okay? Let's get into the frequently asked questions because I find that's really what most people want from today. So let me go back over here, just give a scan. Diet, how to stretch without pain, lubricants, if bleeding happens, then what next? Analingus, is that safe? Look at all these questions. Okay, fabulous questions. We're gonna get to as many of these as we possibly can. Okay, I'm gonna give you an overview of the structures that are involved in anal play, specifically the rectum, anal canal, and the anus. The musculature that's involved, sphincters, and also the puborectal sling. I'm curious in the chat if anyone just wants to share who's heard of the puborectal sling. I would love to know that. If you have, I want to know about it. It's rare that people do. And also pelvic floor muscles. And then sources of pleasure, we'll talk about that throughout because really today is going to be just about pleasure. Lubricants, and then also poop, because that's one of the things that people are concerned about. We'll talk about fiber and douching and also the microbiome. Again, we've got lots of resources available to you on this website, so I'm going to plug that again here. But let's get into it. So here we've got a human being over here, and this person's like facing you this way, and I just want to orient you to here. Over here is the asshole, the anus, the anal opening. Here's the anal canal, just the first few inches. And then here's the rectum, and then it bends, and this is the sigmoid colon, and then it goes up to more parts of the body. We're just going to focus on this part over here. So there is the colon that precedes this part. It's about 6.5 feet long, and then the sigmoid colon is this part that bends. It's S-shaped. It's the end of the colon. It leads into the rectum. Now, this is important for me to mention because as gas and fecal matter or poop starts to migrate through your body, it ends up over here in the sigmoid colon. It doesn't just rest in the rectum. It's not like there's poop or gas that's just sitting in there all the time. It's only after the poop or gas kind of leaves this little curve here and enters the rectum that you start to feel the, ooh, I gotta go. There's something going on there. So let's talk about that a little bit more. Here's the sigmoid colon. It's a little bit easier to see the bend here. And then here's the rectum, and here's the anus, and then here's the opening. You'll see lots of images here, trying to convey this in lots of different ways. Okay, here's the rectum. It's about 5 to 9 inches long, and it's about 1.5 inches wide. This all varies from person to person. But I want you to think about something. Okay, if it's 5 to 9 inches long, what if you put an object in there that's longer than that? You are likely to enter the sigmoid colon. And the sigmoid colon is where gas and poop tend to live before they enter the rectum. In fact, the rectum is like just kind of a waiting station. So once something enters here, you get that sense of fullness, and then you release. And when you release, if you've got enough fiber in your diet, generally you're releasing all of the poop as well as gas, whatever's in there, out. And what's left behind is very little, if anything, just microscopic bits. But if you introduce an object into the rectum, the likelihood of encountering poop is pretty low if you've got enough fiber in your diet and your digestion is solid. That's not the case for many of us, so let's say there's a caveat there. But if you enter a little bit higher, you're more likely to encounter poop. So the rectum fills with poop and gas right before release. It's generally empty at other times. Another image here of the sigmoid colon, and here's the rectum, and here's the anal opening and anal canal. Let's get into the anal canal. Haha, let's get into the anal canal. Here it is in pink. It's the first few inches beyond the anus. There are 2 rings of muscle called sphincters that close and open the anal canal. So it's a little bit like if I hold up my hand and you kind of imagine this is an asshole, this is the anal opening, the anus. There's a ring of muscle. I'll do this. It's opening there, and then you see there's an inner one as well. So there's an outer one and there's an inner one. And it's important to understand the distinction between these two. Here's another image of the anal canal. It's a little bit more detailed. So here's the opening. Here's the anal canal, first few inches. Here's the rectum, and then you can see there's a bend here to the sigmoid colon. Here's the inner sphincter, and here's the outer sphincter. And you see how they relate to one another. If you're looking at them, you can't see them because they're beneath the surface, but you can feel them if you put something inside. Here's the anus, or the anal opening, or the asshole. It's very densely packed with nerves and very sensitive to touch. So I want to ask you all to do something with me right now. I would like you to take your hand, one palm up, take your finger, and I'd like you to touch the center of your palm with your other finger. Just notice what that's like. Now flip your hand over and touch the top of your hand. You probably notice a difference, that it's more sensitive in the palm of your hand. And that's because it's more densely packed with nerve endings there. So this is very densely packed with nerve endings, very sensitive touch, which can be very pleasurable if it's being touched by someone or some people or an object or something that you enjoy. A tongue, a hand, a toy, a penis, whatever it might be. This suggests that anyone with an asshole has the potential to feel pleasure, regardless of what sex they were assigned at birth, or their gender identity or sexual orientation. It's just a physiological source of pleasure. Now, that's not always the case, right? Like I have lived in New York City. I have been on the subway. And I remember a friend of mine telling me that she was holding onto the subway bar and someone like touched her hand while she was on the subway bar. That is unpleasant for her. So it depends on the context. It doesn't mean that just because someone holds your hand that you, or touches your body in some way, that you're going to derive pleasure. It's not like a button that turns on. The context is really important. All right, let's get into the anal canal a little bit more here. The outer sphincter, this part here, is a voluntary muscle. You control it at will, kind of like your mouth. Not exactly. You can't move it exactly the same way. You can't talk with your external sphincter in the way that you can with your mouth and your lips. I should say lips. It's not really your mouth. Your mouth is on the inside, but your lips are what's outside, and your lips are a sphincter. The inner sphincter is an involuntary muscle. You relax to open it. So even if you just sit here right now, whatever you're doing, and you clench your butthole, you will notice that you can clench that, right? You might also notice that it starts to relax when you stop clenching. And that is an indication you have some control over your outer sphincter. The inner sphincter, though, you can't just relax it open. It takes some breathing, sexual stimulation, something erotic, something arousing in order for that to happen, and or something entering the rectum and giving your body a cue. Oh, this is full. Now it's time to start to open this up and relax it. The outer sphincter is part of the sympathetic nervous system, meaning you have some voluntary control over it, and the internal sphincter is involuntary muscle. It's part of the parasympathetic nervous system. You can't just open it at will. Now, this is related to emotional care. I don't know if any of you have heard this from your clients or experienced it yourself, that sometimes people say, I don't understand why anal sex feels so much better for me when I feel like there's an emotional connection. Doesn't necessarily mean that they're like, I'm not talking about like intimacy in the sense of I know the person. It doesn't have to be that, but just some sort of emotional connection. That is related to this parasympathetic nervous system of the body. Your emotions are also part of the parasympathetic nervous system, and they communicate with all parts of your body. So if you feel like you're open, this will open. If you feel attracted, this will open. Not in all circumstances, and so there are some tips to help you with that, which we'll talk about in a little bit. Okay, just another image of the internal sphincter and the external sphincter. All right, I think I'm doing okay on time here. I'm gonna take a risk here. I know we're a large group, but I just want to see if anyone has a question about something that I covered so far. And you can put that in the chat, or you can take the risk of unmuting for a moment, just in case that works. Any questions here?
I will say I have been entering some of the questions that had been dropped in the chat within the Mentimeter. There have been a handful since you've been speaking.
Will you tell me what they are?
So you had asked a question about wanting to know if people had experienced or knew something about one specific. I can't remember what
Puborectal sling.
You said what?
Puborectal sling.
Okay, so there were a handful, like there were a couple of people that had responded and said that they had.
Great.
And then the other thing was, I'm trying to make sure to address. So, do you recommend using a different type of condom for anal sex versus vaginal sex? That was one.
Okay.
And then someone had mentioned the safe practices for condomless sex, anal sex.
Yep.
And then for, in case it was missed in the chat, and some people have asked about slide shares and recording. So this is being recorded, and it will be uploaded to our YouTube channel, which is EndHIV901. And then the slide share, that is completely up to Brian. And if he would like that, we will send out a recording as well by email to all people who are currently on the call.
Yeah, happy to share the slides. You'll get a PDF of the slides after this is done. Yep. Okay. Great. Okay. I'm going to keep going because it's not specifically about this part of the anatomy. We'll cover some of these other things a little bit later. Another image of the internal sphincter and the external sphincter. This one just came out in a scientific article. It's the first time I've seen this kind of image, and particularly in an article that's about anal sex. And then here's an example of a toy that's being introduced. And I want to be very clear about something. In terms of, someone asked about safe practices and harm reduction related to anal sex. Right now you're seeing the internal sphincter and the external sphincter. And remember how I said the internal sphincter is part of your parasympathetic nervous system. It's involuntary, which means you can't just control it. If you introduce an object into this part of the body that doesn't have a flared bottom, in other words, a flared base that's bigger than the anal opening, there's a chance that these muscles can contract and start to push that object into the body and further up into the sigmoid colon and further up into the body, which is why we always recommend, as harm reduction, whatever you put in, make sure that the base of it is larger than the anal opening. All right, it's time for a little video. So I'm gonna introduce you to the puborectal sling. A few people know what that is, but other folks don't. So let's get into that. Oops, it's over here, I believe. Here we go.
This is where your ice cream comes from. The creamy poop of a mystic unicorn. Totally clean, totally cool, and soft served straight from a sphincter. They're good at pooping. But you know who sucks at pooping? You do. That's because when you sit on a porcelain throne, this muscle gets a kink in a hose and stops the Ben and Jerry's from sliding out smoothly. Is that
That muscle is the puborectal sling, which we're going to talk about momentarily.
a problem? I don't know. Are hemorrhoids a problem? 'Cause sitting at this angle can cause hemorrhoids, bloating, constipation, and a buttload of other crap. And seriously, unicorn hemorrhoids? The glitter gets everywhere. But what happens when you go from a sit to a squat? Voila! This muscle relaxes and that kink goes away faster than Pegasus laying sweet sherbet dookie. Now your colon's open and ready for battle.
All right, I'm not going to show you this whole commercial, but I do that because I want to introduce you to this puborectal sling muscle. Super important muscle, and rarely do people know what it is. One of the questions that I often hear is, what about the second hole? Like, I feel like there's a second hole somewhere inside. Like, I put a penis inside of someone and I feel like there's the first hole, there's a second hole. Or I feel it myself when someone's inside of me. So some of that may be that when people are introducing something into the anus, past the anus and into the anal canal and then into the rectum, this external sphincter, it's opening. It's ready for business. I'm game. But the internal sphincter may remain closed or spasm closed if someone's not fully relaxed and open to it. So that could be it. Like, I feel one hole got past, but where's the second hole? I can't get past it. Now, there's another aspect of this, which is related to puborectal sling. Now, imagine, it's hard for me to position myself with this, but imagine I'm kind of facing you, and this is the front of my pelvic bone, the pubis. Here's the tailbone. Here's some butt cheeks over here, and then here's the anal opening, the anus. And you'll see here, there's the internal sphincter here and the external sphincter. And then there's this muscle, this sling muscle. It attaches to the front of the pelvic bone and it wraps around the rectum and then attaches there. That is a puborectal sling. And it is, most of the time, it's cinched tight, it's cinched closed. In fact, 80% of your ability to hold poop and gas inside of your body is this muscle. A lot of people think it's the sphincter muscles, that those are the things that keep things in, but that's not the case. It's 80% is this muscle instead. And then very importantly, you notice what happens to this muscle if you're just sort of standing or sitting on a toilet in that kind of position versus squatting, which is what most people on the planet do when they poop. Most people squat. It relaxes that muscle. And this angle changes. So if something's going in and someone says, I feel like there's a second hole I have to get past, it might be because this muscle is cinched forward, closing access. Whereas in certain positions, so for example, if someone has their knees at their chest and someone's entering them kind of missionary style, then this muscle can relax and the angle is easier for entry. This also happens when gas or poop leaves the sigmoid colon and enters the rectum. That also signals what we call I forgot what it's called. Just like the rectal reflex. Haha, luckily it's on the next slide. So when gas or poop leaves the sigmoid colon and enters the rectum, we feel the urge to relax and release. This is the moment when you're like, ooh, I got something going on. That fullness in the rectum communicates to the puborectalis, also known as the puborectal sling, which then relaxes. It moves from this position where it's cinched to a more relaxed position. And then you poop. Now, most of us have some trouble with our rectal reflex, and this is in part because our diets. So here's an example of someone who's constipated and their poop is coming in hard balls. And what happens is as it's migrating through and then enters the sigmoid colon and enters the rectum, bits of it go in there and we get like, oh, there's something there, but then it's not coming out. It's not coming out, so I got to push. So if we push, what we're doing is we're not paying attention to our own rectal reflex and letting our body do what it needs to do. Instead, we're forcing things, and straining a bowel movement is part of the #1 cause, both of hemorrhoids, which is like a varicose vein in your anal canal, can also be in your rectum, like a pooling of blood that creates a little bump, and the blood can't get back out. But it also is a way in which we kind of divorce ourselves from the rectal reflex and really understanding what our bodies are doing. This can happen when someone's constipated. It also can happen if people don't have enough fiber in their diet, which I'll explain. I want to show you a couple more images of this. Here's another image similar to the one before here, but a little bit more detail. Here's the sling muscle. Here's the internal sphincter, the external sphincter. Here's the anal opening, some tiny little butt cheek things here, hard to see. And then what you see here is this first curve in the rectum. This puborectal sling is responsible for that first curve in the rectum, which is also why it might be what people refer to when they say, I feel another hole that I have to get past. And then here's the rectum.
I have a question.
Go for it.
So, with the muscle that's like holding things together, it wouldn't tear by any chance if the person is like entering a certain way?
Yeah,
Like,
great question.
Re-
I love this question. Thank you for asking. So the likelihood of that tearing is not very high because you can't really access that muscle from entering. So you can't access that muscle. You'd be entering through here. But what you can do is if you bump that muscle while you're entering, if someone is in a position that's kind of uncomfortable for them, or that muscle hasn't relaxed, or even if they just feel like, I'm scared, I don't know what's going on, that muscle can contract because it's part of the involuntary part of your muscle, the parasympathetic nervous system. So it can cinch closed if someone feels an emotion of fear or anxiety. Likewise, if you go in here and just at a particular angle, you happen to bump up against that muscle, well, what is that muscle's job? That muscle's job is to cinch things closed. So it will cinch closed and also potentially communicate fear and anxiety just because suddenly something closes and it's tied to those emotions. So the likelihood of tearing something here is very low, but it is possible to tear things over here if you force entry, for example, into the anus through the external and internal sphincters. Less likely for there to be damage here.
Thank you. Yeah, because I was like confused too because I see that it's wrapped around right after the entry part. And I'm like, okay, so what if a person go past that and it's like around the muscle part? Would that affect the person from the person that's receiving?
Yeah. So look back over here, and here's a little bit of an answer. So imagine trying to get a penis in here, or a finger in here, or a dildo in here. If it goes in, right, it's kind of like, if it's a straight object, where's it going? It's kind of like bumping up against it, right? Whereas if it's relaxed, you see, it's easier for something to go in and out.
Got it.
Yeah. And as people are stimulated, as people start to enjoy pleasure, things get communicated to the body and this muscle will relax. That's what happens over time.
Thank you, Brian.
You're welcome, Leah. I'm so glad that you asked. I love interaction. So we are such a huge group that I wish it could be even more interactive, but if you got a burning question, please ask it.
I don't mind asking questions.
I will say there was an additional one that many people had said that they shared this same sentiment to this question, or many people wanted to know the answer. So is the boundary between the rectum and the sigmoid colon the second hole? I've had clients talk about a second hole.
Yes. Okay. So let's go back for a moment. So glad you said this. Okay. So this is a few inches here. Is there a better one? Here, this is a better one. Okay. So this is a few inches here. This is the anal canal. Then we've got the rectum, 5 to 9 inches, right? So now we're going like, let's say 6 to 10 inches, all right? So this is 6 to 10 inches. So the likelihood, look, there's all sorts of endowments in the world. There's also fisting and introducing other objects into the body. So a fisting is introducing a hand into the anal canal and up, and it's possible to get into the sigmoid colon then. But usually when people are talking about the second hole, they're either talking about the internal sphincter and that having to open up, or they're talking about this puborectal sling having to open up and relax. Because you can see here, even if these two are open, if this one isn't relaxed, it's going to feel like there's something else I have to get past. So that's usually what people are talking about. Okay, let's go on another image there. Okay, here's what the puborectalis or the puborectal sling looks like. If you were to look at the top of my head, and then you could see my pelvic bone. Here's the anus, the opening there, and then there's all these muscles. These are the pelvic floor muscles that hold things in. And here is the puborectalis muscle, which is attached to the front and then cinches closed. You'll notice these muscles, or these pelvic floor muscles we'll talk about in a moment, they hold everything in. They hold everything in like a bowl, holding in your internal organs. And they're very much related to anal pleasure. Let's talk about pleasure. Let's talk about the clitoris, in fact. And I'll point you to an article that's about how people with a clitoris, at least in this study, women, derive pleasure and what they do to derive pleasure from anal sex. Let's go with the video, though. This is a sex educator, and I didn't know anything about the whole body of the clitoris until about 15 years ago when I came across this video.
The body is absolutely boggles my mind. Now, I've spent a lifetime drawing the nude. When I actually discovered the internal clitoris, it was, I think it was in the early 90s. So this is the internal structure of the clitoris, the leg of the clitoris. It's like a wishbone. After the clitoris, clitoral glands, bulbs of the clitoris that go down and deep in the body on either side. We have nearly as much erectile tissue as men. We get erections too when we get turned on. But because it's internal, and most of us have been so badly repressed that we don't even recognize when it's happening. And here we have vaginal opening, urinary tract opening, inside the body. This is all inside the body. There's the little perineum. Space between for a man, it's between his asshole and his balls, and for a woman, it's between her asshole and her vagina, the perineal sponge. Best of all is in the little, this is 8,000 nerve endings here, so this has got a lot. You can feel your clitoris get an erection. Well, let's go on down. I don't want to leave out the asshole. I must say I'm quite fond of the little buddy hole. It's cute. Here's the PC muscle. When you tighten your PC muscle, and you can feel it in your clitoris, and in your vagina, and in your anus, then we can deal with the external. So here we would have outside. This would be pretty closed. You wouldn't see too much. And we'd have the inner lips, hopefully nice full ones. They're my favorite. Oh, outer lips. And you're not going to see much of the pee hole in here. Vaginal opening will be not easy to see either. Oh, I just can't control myself. It's different in absolutely every woman. It is amazing.
All right. I smile every time I see that because I'm so entertained by how much she's entertaining herself. Let's talk about the legs of the clitoris because not everyone knows about this. What you see in the purple here is what people are used to thinking about, or used to think about, was the clitoris. It's just kind of what's beneath the hood. But actually, inside of the body are all these structures. And these structures are actually remarkably similar in terms of whether you have quote unquote male anatomy or female anatomy. They're just corollaries to one another. Here's an image of someone who has had some gender reassignment surgery, sex reassignment surgery. And this is a neophallus, but you see how the clitoris is still here. And then what I want to point out here is this internal part of the clitoris. You see how it extends back into the body? And then here's the anal opening in the rectum. And you notice this is an example of fingers going inside. You see the internal and the external sphincter. And you notice how close that is? It's actually possible during anal stimulation to stimulate the clitoris from the inside. This is part of the reason why some people with the clitoris experience pleasure during anal play. Now, the pleasure may also be happening because there's some stimulation of the anal opening. I mentioned like the sensitivity in the palm of your hand. Also, the rectum itself, the sensation of fullness there can also feel quite pleasant. So any of you you don't have to disclose, but I'll say myself, if you had a big poop and you've released it, it can feel really pleasant. It actually can stimulate nerves and give you these kind of chills and thrills too. Now, here's an example of someone who's not had sex reassignment surgery. Here's a clitoris and the legs of the clitoris. And again, here's a penis going in, and you can see how the penis would be stimulating the legs of the clitoris from inside. Here's another image. Here's the... Oh,
I was gonna ask a question.
Please do it.
So I was thinking you said that was like the sex reassignment.
Yeah.
Okay, so do they still have like an orgasm?
Yeah.
Okay.
Still possible to have an orgasm. It is amazing what science and medicine can do. It's lovely that people can live their lives and still live their lives in the gender that they are, their gender identity, and also experience sexual pleasure. So you can have both of those things in life. Okay, so here's another image, but this is like, imagine you're looking at someone's butt and their vaginal opening here. And you can see in blue, that's the legs of the clitoris, the bulbs of the clitoris. And there's the clitoris in yellow. That's the little bit that historically I was taught that's what the clitoris was. Get this also, the clitoris is the only organ in the human body whose sole purpose is pleasure. Makes me envious that I don't have one of my own. All right, I'm going to point out some of these images came from an article that just came out, literally just came out. So I want to point you to our website. And here we have, I'll cover these resources, but we have a little clinic resource area. And then I'm going to go to this article. This is a huge article that literally just came out last week or the week before. And in it covers all sorts of cool stuff. And these images came from this study, this systematic review, this review article. I've never seen images like this in science literature. It's really phenomenal that things have changed in this way. There's even like discussion about innervation and the sources of orgasm. And over here, there's like stuff, oh, here it is, for clinicians, like an algorithm for how to help people. It's a really terrific article. So I want to highlight that today. Okay, let's get into a little bit more. Now, for folks who have a prostate, they might ask the question, when I'm bottoming means taking something into the anal canal and the rectum. When I'm bottoming, it feels like I'm going to pee and then like I'm going to come, ejaculate, or have an orgasm, but nothing's coming out. What is going on? Some of you on this call may relate to this too. This feeling of like, oh, it feels like I'm going to pee. Well, let's talk about that for a moment. This is about your prostate. And you can feel the prostate inside the rectum pressing toward the belly button. That is around the same area that you would feel if you had a vagina and you pressed forward about a couple inches in and toward the belly button. That's where the G spot is, or the Grafenberg spot, which is also associated with orgasm and pleasure. Here you're looking at a cross-section of a human being. So they're kind of facing away from you, kind of cut in half. You see their penis, testicles, anal opening, anal canal, rectum here. That first curve in the rectum, that's where the puborectal sling would be. Kind of and then here's the prostate, which is this walnut-sized organ. It's not hard like a walnut, it's spongy. You can see little like cavities here that are filled with liquid. That muscle is right next to the bladder. So if you press against that, you're pressing against the bladder, so it can feel like, oh, I gotta pee, even if there's no urine to come out. Here's another image, anal opening, rectum, prostate is here, and also you see how close it is to the bladder, and that the urethra passes through the prostate before going to the end of the penis in this case. The experience of orgasm in people who have a prostate, the experience of orgasm is the squeezing of muscles around the prostate. That's why it is so pleasurable. And you can imagine, oh wait, here's another one of urine. You can see like how urine passes through the prostate. And then also here, I want to convey this message that rubbing the rectal wall in that particular area where the prostate is, either with a finger, a penis, an object, rubbing that wall can produce the sensation of orgasm and also can heighten orgasm. So this is one reason why people might say, it feels like I'm being jacked off or stimulated from the inside when I'm bottoming, because that's being stimulated. It may feel like peeing at first, as we mentioned before. It's like the G-spot in quote unquote female anatomy. Of course, it is not the sole source of pleasure. And I'm very happy to report that there are more and more articles that are talking about anal pleasure and sources of pleasure that are not just limited to one thing. It's more diverse now, which is really lovely. Here's a little image from Adult Swim showing the pleasure that can be derived from stimulation of the prostate. Now I want to point something out. Here it looks kind of like they're poking, but it's really about stroking. It's not about poking. Rubbing the prostate, stimulating that way is much more pleasurable than poking it. And then I want to point out also that I said before, orgasm results from muscle contraction around the prostate. That can happen even without ejaculation. Ejaculation and orgasm can be distinct experiences. The prostate is also, I said it's like a walnut sized, but it's not hard like a walnut. It's more like a BlackBerry, not the device from 2006, but or maybe it was later than that. Anyway, it's filled with liquid and it's got these little sacks of liquid. So it's spongy. Another reason that people might experience pleasure here, if someone asks you like, I don't know why it is that I'm enjoying it, or if someone says, I don't know why people enjoy anal sex, you've got lots of answers now. You got the clitoris, you got the anal canal, anal opening and the sensitivity there, the fullness in the rectum, the prostate, and then you've also got this, which is the bulb of the penis, which is very similar to the bulbs of the clitoris. These are just similar structures in the human body. So it also can feel like you're stimulating the penis from the inside when this part of the body is being stimulated. Here's another image of the bulbs of the penis, or the bulb of the penis here. Here's the prostate. It's kind of hard to see here. Right there. There's the bladder, bulb of the penis, and the rectum here. Again, just another thing just to point out the stroking rather than the poking. We call this the P spot, akin to the G spot, because it's a couple inches in and you can access it inside of the rectum. Let's talk about toys just for a moment. These are anal beads. I'm going to point out they've got a flared bottom, so these can't migrate further up. But also you'll notice that it's up against the prostate. So you can imagine that's how pleasant that is, or could be. You also may hear from folks who will say that they're... Oh, we need a mute. Got it. Okay. You also may hear from folks who say, I'm straight, but I like it when my woman puts a little finger in there. Or, my boyfriend's straight, or my husband's straight, or whoever I'm having sex with is straight man, but he does like a little anal play. That can be because of the prostate. And also, as someone is aroused and before they start to orgasm, or as they're about to climax, if you stimulate the prostate, it creates even more pressure there. And remember, the pressure on the prostate is what is associated with orgasm. So you can see that this toy can also stimulate that. And then here's an example of a toy which kind of sits inside of the rectum, and you can use your pelvic floor muscles to stimulate the prostate, to apply pressure there. Okay, there it is again. This is an image of a penis inside of someone else who's got another penis, and here's the prostate here. It looks like a little eggplant. I think they did it intentionally just because of emojis, which I kind of think is fun. I showed some images before, I think, of trans feminine people. Here's another example just of, here's a neovagina, and here's the prostate here. So you can see in a neovagina that's been constructed, stimulation inside of the vagina can stimulate the prostate and cause pleasure. Let's talk about the pelvic floor muscles. They are very similar in folks who have a clitoris and in folks who have a penis, or have some combination of those things. There's a pubococcygeus muscle, the PC muscle, the bulbocavernosus muscle, the transverse perineum, and you notice they're similar. Like there's not much difference. They exist in lots of folks, in nearly everyone. I mentioned before that the separation of orgasm and ejaculation is something that's possible, and there are guides about that, how to become multi-orgasmic if you have quote unquote female anatomy, or if you have quote unquote male anatomy, if you have a combination of those. I've never seen a book that's for folks who are intersex, but hopefully there will be at some point.
I have a question.
Yeah, please.
So I also put it in the frequently asked questions, but is there any correlation between bottoming or receptive anal pleasure or receptive anal sex and erectile dysfunction? Because sometimes I have clients that say that they're a bottom or whatever, and they would like to get hard, or they're unable to become erect or maintain an erection while they're bottoming. So I wanted to know if there was any scientific evidence behind this.
Yes. Okay. I'm so happy you said this. Okay. Thanks, Shalik, for asking that. So here it looks like this penis is erect while another penis is inside. But it's frequently the case that as people start to experience pleasure in this part of the body, they experience less stimulation over here and may not even feel like they need to. It's normal, actually, in fact, to experience pleasure over here and to have a flaccid penis or a semi-hard penis, but not a hard penis, especially if there's not any stimulation that's happening over here at the shaft of the penis. Totally normal experience to have. I'm so glad that you asked about it, Shalik. Sometimes what happens, you're welcome. There's pleasure that's radiating over here, and like, I'm enjoying that. I don't necessarily need a stimulation here. Great question. Okay. Okay, let's talk about these muscles. So here's another image of them. Someone in the chat mentioned Kegel exercises, and you can do this right now. So if you would, you don't have to disclose that you're doing this, but I'm going to do it for you and ask you to do it if you're willing to. If you put both feet flat on the floor, sit in your chair, relaxed, wherever you are relaxed, you can do it laying down too, or standing even. If you just squeeze your asshole, you'll notice that you start to feel other muscles squeeze too. The muscles that are between your vaginal opening and your asshole, they'll start to squeeze too. And then if you relax those muscles fully, you'll notice a change. And what you might do is also just imagine that you're about to pee and then stop yourself from peeing. You're squeezing these muscles. Just like any muscle in the human body, you can exercise these pelvic floor muscles. We call them Kegel exercises. And folks who have a clitoris, we tend to say, imagine it's like an elevator going up and an elevator going down. And folks who have a prostate, we say squeeze those muscles in your taint between your balls and your asshole, and then fully relax them. And there's a varieties of ways that you can do these. You can do fast ones, you can do slow ones, you can hold it for a long period of time for 10 seconds and then release them. These muscles are the muscles that squeeze around the clitoris and the prostate. So they are responsible for squeezing and creating sensation of orgasm. You can strengthen these muscles in such a way that you can prolong your plateau, so that if you feel like I'm about to orgasm, let me hold off. Well, if you strengthen these muscles, you can hold off on orgasm, which is part of what helps with becoming multi-orgasmic. You might also hear from people, I'm concerned about keeping my hole tight. So that's a frequently asked question. You can teach them about Kegel exercises to strengthen these muscles. There is no evidence that I've seen that's really substantiated this idea, this myth that if you have a lot of anal sex, that you will get too loose and you're gonna, poop and shit when you're older in life. There is some association in some studies with that, but those studies don't account for that people are not tolerating pain or discomfort. If someone is very experienced with anal sex, other research suggests actually there's no changes here. In fact, when I talk to medical professionals about this, they suggest, well, it's like any muscle. If you exercise the muscle, it's healthier, right? If it gets more blood flow, as opposed to if it's not getting that blood flow in the sense of like things are flowing down there, not blood coming out, but blood flowing to these muscles and making them healthy. Okay. Another thing that people talk about in terms of like frequently asked question is like, how to relax into anal sex. And so we've talked about a couple of different ways just about arousal. Communication is also really key. It's also the case that people feel anxious because they're worried about poop or something or making a mess on someone. So we'll talk about how to manage that with douching and fiber as well. Some people also use something called poppers or amyl nitrate. This is it's up here. You can see it. I can't see it, but you can. You can see here a little bottle here. This is it's not sold as a drug, but it was originally sold as videotape head cleaner because it's a volatile liquid, which means that when you unscrew this cap, it's a liquid inside, but it turns into a gas immediately, and you can inhale it, or you can put it on a cloth and inhale it from the cloth. It causes blood vessels to dilate and then a rapid drop in blood pressure. When the vessels dilate, it means that these muscles that we've been talking about in the pelvic floor, but also the puborectal sling, the internal sphincter, they relax. So people are like, oh, I can finally let something in. Now, what happens in response is because the blood pressure drops, the heart pumps really dramatically to stabilize the pressure. So that's why sometimes these are called rush, and there is a rush associated with it. And there's at least a couple articles that I've seen that talk about how it reportedly relaxes anal muscles. It hasn't been measured in people, but people talk about that that's their experience. And you may have heard of this too. Because it causes blood pressure to drop, it's also suggested, like not suggested, but advised strongly, don't use this with Viagra or other erectile dysfunction drugs because you'll end up having some issues. You can cause heart problems with that. Likewise, if you have a heart condition, please talk to a physician, someone about that before you use poppers. People also talk about headaches and scared, panicky feelings, and there are impurities because it's not a regulated drug, but it is very common that people use it. Now, another concern I mentioned is people are concerned about poop or painting someone's dick or finger or whatever it is. And there's increasingly research about this area. Luckily, it's terrific that it's being done. About 80% of gay and bisexual men say that they douche regularly, and 10% of them report rectal bleeding after douching. These are very large online studies that have been conducted. The message here is that providers should discuss douching safety with their patients and focus on harm reduction, reducing the risk of bleeding, as opposed to abstinence. If 80% of people are doing something and you tell them you shouldn't be doing it, guess what they're going to do? They're not going to stop doing that. They're going to stop seeing you and talking to you about it. So instead, we've got to think about some harm reduction options. That is where fiber comes in. Fiber is probably the easiest solution for most people, but our digestive systems, our GI tracts are not universally the same across human beings. We all have different relationships with them or dealing with different conditions. But one expression someone came up with in a workshop, which I love, is an apple a day keeps the shit away, which was a way of trying to market that fiber, which is found in apples, in other fruits and vegetables, it's a substance that your body cannot digest. So what it does is it bulks up your poop. Now, if you, let's just say this also, before I get into fiber a little bit more. If you're someone who's committed to douching, the recommendation is to use warm water and a smooth-tipped, lubricated device a few hours before sex. And I'm going to point you out to something on our website here. Under resources, we have a little guide for how to clean your ass before sex. And there's a little caveat here because one of our beloved advisory board members said, there's a couple of things I want to point out. This is what this little guide looks like about douching, but then there's little caveats here also. Before you read that, you should read this first. I'm not going to go into all of the details of it, but the take-home message is just warm water, a smooth tip device, lubricate the tip, do that. And generally, people introduce just enough water to fill the rectum, then release that water, do it again, release, Generally, people do it on average about 3 times, but it really depends on what you prefer. Alternatively, if you increase the amount of fiber in your diet, this is what happens. So you see these are little pieces of poo, those little stars. Here's fiber, which bulks up.
It works like a sponge going through your body so that when you go, you fully go. This, of course, reduces prep time and makes you more comfortable and confident.
All right. It's a super fast image, but what happens is because you cannot digest fiber, it goes through your digestive tract and it starts to collect little bits of stuff. That's super important because as the fiber...
It works like a sponge going through...
as the fiber... Should have had another image here, but here. As the fiber... Oops. This is your sigmoid colon here. It's a little bend curve here. As your poop leaves here, it comes into the rectum full. And if it's full, that's communicating your rectal reflex. Oh, it's full, it's time to go. And because the poop is bulky and sticking together, if you then release it, generally there's not much left inside of the rectum. So this is why we recommend, as an alternative to douching, to add fiber to your diet and do it bit by bit. You can add supplements like psyllium husk or chia seeds, other things that are sold over the counter. Metamucil is a name brand that's used. We'll talk about that more if people have.
It works like a sponge going through your body so that when you...
I'm really plugging the fiber here. Okay. I mentioned that resource already. Let's talk about lubricants, and then let's do a couple more things, and then see if we got some time for questions. So lubrication, the anal canal and the rectum produce a little bit of lubrication, but not a lot of lubrication. You really have to introduce an additional lubricant. And people do that either it's pre-cum, it's spit, saliva, or it's lube that you add. And many of you probably introduce lube and offer that to your clients. Hopefully you do. There are 3 kinds of lube. There's oil-based lube, water-based lube, silicone-based lube. I'm just going to cover the basics here. But I also want to point out that the rectal mucosa, the lining of the rectum, it's 1 cell thick. It's not very lubricated. And without lube, it tears really easily when objects are inserted. The other thing about douching to keep in mind is that douching washes out that natural lubrication that's there. And depending on what might be in the douche, if it's not just water, it can deprive the cellular lining of liquid and then dry out those, and then that can cause some problems too. So about 14 years ago, this wonderful organization, the International Rectal Microbicide Advocates, which doesn't exist anymore, created this wonderful flyer just summarizing some of the research. I will point you to more of the research on our website. So for water-based lubricants, these are safe to use with latex condoms and silicone anal toys, but they get absorbed into the body pretty quickly. So you have to add more of it, or you have to add more water to it to kind of rejuvenate it. Silicone-based lubes, these are little tiny beads, not uncomfortable beads, but they slide against one another, naked to the eye. So you can't see them, but they slide. So they're safe for latex condoms, but they are not safe for silicone anal toys, because if you add a silicone-based lube to a silicone-based anal toy, kind of eats away at it does eat away at the anal toy. But these last much longer inside of the rectum. You got to be careful about your sheets though, because they also can stain your sheets. Oil-based lubricants, some people like this for fisting because they really last a long time. They're not safe for latex condoms. They also gather bacteria, and particularly on anal toys, in such a way that physicians recommend not doing that, but they do last longer. So when you're having a harm reduction conversation with someone, it's about figuring out what works for them, right? So this is why I'm not saying this is what you should do versus what you shouldn't do. It's a conversation about what someone wants for themselves. Numbing agents. There's something called anal ease. This is one brand of them.
Quick question about lubricants.
Yeah.
What category does Vaseline fall under?
Vaseline is an oil.
Okay.
Yeah, glad you asked. There's also something called numbing, or a category of things called numbing agents. This brand is called Anal Ease, and it's strawberry flavored. And what people do is they introduce this on the outside of the anus. Remember, I said it's very sensitive there, right? Like the palm of your hand. So you can introduce this numbing agent and therefore feel less pain. But I'm going to say a couple things. One is, this is strawberry flavored. I have no idea what's inside of this. And in fact, actually, when we go back to lubricants, people use them for anal sex, but they have not been studied for that purpose for the most part. There are a couple studies that have been done on them, but it's not like the Food and Drug Administration regulates these in a way that is conducive to research. In fact, the lube that you buy at the store, the company can change the formula from 1 year to another year and not even have to tell you about it. So it makes it difficult to study lubricants and find out which ones are safer or less safe. In general, what we have learned, though, from this and the summary of research here and subsequent research is that silicone-based lube seems to be less damaging to the rectal lining than water-based lubricants, because water-based lubricants tend to be high in sugars and salts. I don't know that oil-based lubricants have been studied for that purpose. Okay, here we go. Back to this. I say that about lubricants because who knows what's in them? Anal ease, who knows what's in this? Strawberry, I don't know what that flavoring is. I don't know what it's going to do. We recommend not using this for a couple reasons. We don't know what's inside of them. Also, numbing agents deaden sensitivity of nerves. So these sensation-reducing agents, for the purpose of anal sex, they block your body's ability to communicate damage. And I said before, there's no reason to experience any damage. You can have anal sex and anal play with just pleasure. No pain, no discomfort, certainly no bleeding. Bleeding would be a sign of potential damage and needs to be checked out. So likewise, we recommend not using numbing agents and instead finding other ways to increase pleasure. With foreplay, for example, rubbing the outside, stimulating the prostate either through the between the balls, the taint, basically the perineum, between the balls and the asshole, or between the vaginal opening and the asshole. Stimulating that can also allow muscles to relax. Okay, a little bit about microbiome, because I want to make sure we have at least a few more minutes for questions. The message here is never go from anal play to vaginal play without changing a condom or washing up thoroughly beforehand. In the same way, if you have a vagina, you've been taught wipe from front to back because you don't want to introduce the bacteria that's in the back into the front. Go ahead, Elijah.
Quick question. So what if it's with the same person though? Is that still, I mean, it's still kind of like high risk, right? Or risky, but what if it's with the same person? Is that still okay? Or that's still like a nah, because you don't want to mix the I guess the bacteria or the fluids maybe?
You're answering your own question. I'm so glad that you have.
Oh, okay, good.
It's not about the fluids, it's the bacteria that's inside of the fluids. So the anal canal, even though I said the rectum is generally free of poop, if you've got enough fiber in your diet, there's still microscopic bits of bacteria that are in there that you can't see. And microscopic bits of poop could be in there too. They likely are. So generally we just say, preparing for anal sex, just wash with water and soap. That's sufficient, rather than douching, as I mentioned before. But anytime you're moving from the rectum or the anal canal into the vagina, they're just different environments. And the bacteria that live in the rectum do not, well, they may like to live in the vagina, but they're not, your vagina is not going to be happy that they're living there. They're going to cause an infection more likely than not, whether you know the person or not. It's not about sexually transmitted infections. It's just about the bacteria that are in the body.
Okay, perfect. You answered the question. Thank you.
You're welcome. Oh, I see Mark's comment. J-lube and K-lube are both polymer-based and can be considered oil-based lubricants. Thank you for answering that. I'm going to point out another thing here before I start to close out. I mentioned that the first condom was approved just a couple of years ago. This is the female condom, quote unquote female condom, or the internal condom. And get this, it was originally designed for anal sex. See this investigational device? So it was submitted to the Food and Drug Administration for the purpose of protection during anal sex years ago, many, many, many years before 2022. And yet it did not get approval for that. This is a video. I'm not going to show it now. I'll leave it to you to watch this a little bit later, but it's a terrific video that came out, I think it's like 2008. Lots of different languages, but it's how to use the internal condom for anal sex. And here you got two men who demonstrate how to use it. It's phenomenal. It's a terrific video. If someone wants to use a female condom, internal condom, they can do that. Also, they're made from polyurethane, so you can use all sorts of lubricants with them without having to worry about the condom being damaged. Okay, I'm going to cover the last little bit here, which I unfortunately couldn't get into a lot. But this is, if you're sitting here like, ooh, I've just found a bucket load of information or reinforced things I already knew. Hopefully that was helpful. But you might be thinking, how do I communicate this with the folks I work with, or with friends or family or partners? This is an approach. So first I'll say, there's a reason why health workers don't generally talk about sex. There are lots of reasons here, which you may see in yourself. One of them is this fear of opening up a can of worms, or worrying about kind of what's going to happen, or like it's too much to open it up. This is an approach to very briefly ask people if it's okay if you offer information, and then ask for their understanding. A lot of folks learn this approach, but they may not learn it with this name to it, ask, offer, ask. The first bit is to ask an open question to hear the person's perspective about what they already know. So let's take Elijah. Like you said, okay, so you're concerned about whether this might be fine to do with someone who's is a regular partner. You know them really well. So you're not sure whether it's okay to go from back to front. Great. Then I might also ask, what do you know about that? Or reinforce Elijah for saying, look, you already answered your question. And then I'm going to ask for permission to offer a little bit. Can I offer, in this case, if it's okay with you, may I share some information that I have? And then offer a little nugget of something. You're right, there are a few things to consider, just a little bit. And then return to asking again, what do you think about that? What does that mean to you in your specific case? Now, we're not going to demonstrate this too much, but here's a little summary of it also. It comes from motivational interviewing, and it's a way of exchanging information with folks. All right, what we wanted to do today, I know we're just 4 minutes away, so we may not have time to answer more questions, but our goal with this project, which by the way is funded by the National Institutes of Health, so it's pretty cool that we got funding for that, is to increase expectations that it's appropriate during an HIV-related healthcare encounter to talk about anal pleasure and health. And also to enable you to be able to communicate in a sex-positive, accurate, and destigmatizing way with your clients. Now, this comes from a 2-day in-person workshop, so I do not have the expectation that you're leaving here like, I got everything I needed. That is not the case, I'm sure. But we have resources. So let me go back to the website here, over here. Just want to introduce you to this. Here's our website, freely available. You can look for different content, formats, populations. This filtering is not perfect, but we're doing our best. And lots of resources here. You click on any of these and you learn some more stuff. Certainly can give this to your clients. Also for clinics, you'll see we've got some patient-facing materials. We've got this poster about just the tips. We've got it in Spanish as well. We have, if you want a poster that's not so, sexy, this can be the title instead of just the tips. We have a palm card that you can also download and print. We'll have a business card up here shortly. We also have what we call a bubble sheet to help stimulate conversation. This is what it looks like. You can download this for yourself and then alter what's in here. And I like the idea of handing this to clients so that they can see some frequently asked questions, write their own, and then that can be the basis of a conversation. And then I also want to point out, these are our selection criteria. You can learn about how we chose what we chose to include. We have this very cool science library here, different topics. And if you click here and then click again, it takes you to these articles and the PDFs. So you can read the actual article, freely available. A little bit more about us and our team. We're adding some more people here who've been partners. All folks here, including our advisory board, other folks. And lastly, that you can contact us if you've got a resource that we're missing. So with that, let me go back here. Our website is listed here. I think Elizabeth also put it in the chat. I think we don't have a lot of time left, so I'm just going to stop the share for a moment and just see if there's any burning question that someone has. We have 1 minute left.
Yeah, I will say there were a couple of mentioned in the chat. So one was, can you talk about soluble versus insoluble fiber, how that can be counterproductive in persons living with HIV, especially long term. So that was one. And then which category do J lube and K lube fall into, commonly used for fisting? So that was another one.
Great. Mark answered the question about J-lube and K-lube. And then in terms of fiber, I'm not an HIV clinician, I'm a psychiatrist. So this is out of my purview in terms of answering this question fully. But one of the issues with fiber is that it can absorb things. So for example, it's helpful to have, if you have like, look, if you eat a Tootsie Roll, that's pure sugar. But if you eat an apple, there's more fiber in there, but there's also sugar. The fiber is mitigating some of the effects of the sugar. Likewise, when you take fiber and you take medication, it is possible that the fiber might absorb some of the medication and make it less effective, in which case you need to consult with your doctor about that, about the timing of your medication and the specificity of your medication in particular. So I'm glad someone raised that. No one has raised that before, so it's a great one for me to cover in the future.
So if I may, that's good information. That's not my primary concern. I just think realistically, you are talking so sensitively about all these issues. People who have long-term experience with HIV, taking fiber may not have the positive impact that you're describing. And it may have the opposite impact because of damage to the gut.
Yep. I'm glad that you mentioned that. This is the case also for folks. I'm glad you mentioned it, Mark. Thank you. It's also the case that fiber can be counterproductive for some of us just because of our GI systems, whether we have HIV or not. So sometimes also when you first start taking fiber, it creates looseness at first. It feels like diarrhea before your body acclimates. So there's more to every single thing I've covered. There's more to each of those things. So I encourage you to go to the website, but also reach out to us if you've got questions. We're going over. I promised Elizabeth that we'd stop after 90 minutes. So I just want to thank everyone for sticking around and really appreciate these questions. I wish I had more of a chance to answer more of them.
Like my goal is always to be respectful to anybody's time, as well as the presenter's time and our audience. So, you know, if people want to hang around and ask some burning questions, please feel free to go ahead and ask those. I know people are steadily logging off, so I do want to go ahead and thank everybody for joining us today. I personally learned a lot myself. It was really interesting. I love the interaction, and honestly, just this continuous open door for learning. So do feel free. Like I said, I can stay on for a couple of minutes, and you're more than welcome. If there's like I said, a burning question you want to ask Brian before he hops off, if he's got time, please feel free.
Well, honestly, I have a question for you, Elizabeth. I'm still trying to do the registering thing, and it's still not letting me proceed with going forward. And I've been trying since yesterday.
For the registration?
Yes, ma'am.
Okay, let me are you able to drop your email in the chat?
Yes, ma'am.
To where I can email you directly?
Mm-hmm.
Perfect.
Someone asked what's my contact information. So on the website, there's a contact us page. So you can enter something there. That's probably the best way to do it. But also the start of the slides will also have my my contact information. And I'll just put it in the chat.
Also, for anyone else who has a question, Claire just posted that if you want CE credit and you were unable to register, we're going to send out a link after this. So if you want to put your email in the chat, you can do that, or we will send out the link after the training, and you can do it that way also.
Perfect. Thank you so much.
All right. Any other lingering questions?
Thank you for the great presentation. You were amazing, Brian.
Thank you very much for saying that, Shalik. I appreciate that.
How can we get access to more presentations or webinars that you're hosting?
So this is it's a funded study by NIH, and we're going to be applying for more funding. but
Okay,
that's a
great.
ways away because it takes a while to do that. There is, oh, this is it. Let me show you. Let me share something with you.
Yes, please. We need more. I feel like this arms our clients with it helps us because we get to arm our clients with more information, you know, and especially things like this. Those of us who have client facing positions, all of our clients have these type of questions, and
Yeah,
you know, we want to be up on the we want to know what's going on.
I love that. I love that. So on the contact us page, you can enter anything you want, but if you just enter your email address and then click here for yes, and then bottoms up send, then we'll send you our newsletter. We haven't sent a newsletter in a while, but the newsletter contains a lot of presentations and articles that I've given related to this topic. So we can make sure you get that. If you just send us an email saying, I want, you know, those, then I'll have someone follow up, either myself or research coordinator follow up with you.
And this is pleasureandhealth.org.
Yes.
Oh, perfect. Thank you.
You're welcome.
Hi, thank you so much for the incredible presentation. I'm wondering, I know that there's some resources in Spanish, but I'm wondering if the whole website at some point is planning to get translated. Because I know that I work with a lot of folks who have a lot of misinformation that's still being taught over in Mexico, and I would love to be able to send over real-time updates. And I'm wondering, like, if I should just do a call with them and translate like what you showed us, because I know a lot of people would love this information and it's still very taboo over there.
Yes, totally. Okay, so I'm glad you asked that. I didn't cover it, but okay, so we were trying to create you can see my screen, right? It's the website.
Yeah, I can.
Okay. So we have like a Spanish translation thing here at the bottom, but you have to pay for it and it's quite expensive. It's based on the amount of stuff you have, and we just don't have the budget for it. But we discovered this workaround, which is if you're in Google Chrome and you go to these three little dots and then go down to translate, then you can translate into a different language. So if I go here and choose Spanish, I don't know if you're seeing this drop-down menu or not.
I am.
You are? Okay, great. Here it is. Translate. And it's supposed to translate. How does it work? It's supposed to.
Let's see.
Translate. Page is not. It's supposed to work. Let me try again.
Okay.
Okay, well, we got it to work before.
It's
we
okay.
were excited.
There may be certain, this is just an observation, but I don't know this to be true because I'm not an ITIS type person, but there maybe it's like certain pages on the website that are translatable versus some areas that aren't, maybe. I don't know.
That might be it. So what we were looking for is like basically we're looking for a YouTube video that shows how to do this. And we did it before, so I don't know why it's not working now. It's probably something I've got to look up, you know.
Yeah, and I'll fool around with it too and email you in case I'm able to figure it out.
Okay.
Because that would be really, really wonderful.
Yeah, it's supposed to work. There's some trick I'm just not understanding because I'm.
That's okay, no worries. I'll try and figure it out myself and let you know. So thank you so much for this information.
You're welcome. You're welcome. Michael, there is a button on the bottom left, but that's a different widget. It's not the same one. It doesn't work as well, unfortunately.
Perfect. All right, folks. Well, I greatly appreciate those who had stayed on a little bit over with us. But with that being said, I'm going to go ahead and stop the recording. But I'll also let you know that we will be sure to share Claire's email within our follow-up as well. As I mentioned, if for those who did log in on by computer and submitted their email, things of that nature, when you signed into WebEx, we'll have your email for follow-up and making sure that you do receive the recording from our end as well. But again, I'm very appreciative of AETC and Claire Bowles for being such a great support on this and being able to produce the CMEs for this training. With that being said, on behalf of EndHIV901, we are super, super thankful that Brian agreed to do this training with us, and I hope everybody enjoyed it. And with that being said, everybody enjoy the rest of your day, and thank you.
Take care, everyone. Bye-bye.
Thank you for having us.